So welcome back. Today we will be talking about the other type of arthritis. Now in life there are two types of arthritis. The first is the osteoarthritis, that is the mother nature. It happens in everyone. The second type of arthritis is the rheumatoid arthritis. That is the type where the body actually creates the problem. The rheumatoid arthritis is an example of the autoimmune arthritises, and this is where the immune system becomes overactive and it attacks the body. It specifically attacks the joints, causing permanent damage. Now, normally the immune system stays medium. If there's an infection or cancer, it goes up, cleans it out, comes back down to medium. But in these diseases, it can become overactive in the wrong way. Now, rheumatoid arthritis is, again, a disease that's been around for many thousands of years. It's been in those Egyptian mummies that we know and love around 1500 BC, but it is very rare. So to give you an example, if I put 5 people in an empty room and watch them for a year, one person would develop regular osteoarthritis. I would need about 10 people in that room for one person to get diabetes, about 50 people in that room for one person to get thyroid disease, about 250 people in that room for one person to get cancer. But I would need 1,000 people in that room for one person to get rheumatoid arthritis. Now, the symptoms of rheumatoid arthritis are significant morning stiffness and swelling. So patients will also often describe that if they had to get up at, let's say, 6 a.m. to get ready to go to work, they actually have to set their alarm for 5 a.m. so that they can unstiffen to get ready to go. Having a little bit of stiffness in the mornings is actually normal. It's part of the regular osteoarthritis, about 30 minutes or less. The other things patients describe is swelling in the small joints, so swelling in the knuckles of the hands, the toes, and usually on both sides of the body. Rheumatoid arthritis can attack things on the inside as well, mostly the eyes and the lungs. Now, the risk factors for rheumatoid arthritis is genetic, so it can run in families, but also smoking. Smoking can double the chance of a person having rheumatoid arthritis than a person that doesn't smoke. The treatment of rheumatoid arthritis is very important because we do know that the earlier you treat it and the stronger that you treat it, you can prevent the permanent damage that happens, especially in the joints, like the deformities. However, to make the correct diagnosis of rheumatoid arthritis involves 3 things. Number 1, listening to what the patient is saying, asking if they do have that significant morning stiffness, if they do have that swelling, etc., if they have a smoking history. Number 2, matching it up with what is showing up on their body. So do they indeed have the swelling of the small joints or some deformities? And then number 3 is checking the labs and the tests. Now, the reason these labs and tests are checked at the very end of this whole process is because, remember, these labs and tests are just measuring an active immune system. They're not very specific. And normally, our bodies have an active immune system when it needs to clean out infection or cancer. And our immune system can create a memory. So there are patients that will get a virus maybe that year or many years before, and it will turn a rheumatoid test positive, and that can stay positive for life. What is important to understand that a positive test, not all of them are disease causing. The way to treat these arthritises, or these autoimmune arthritises, especially the rheumatoid, is you push the immune system down to control the disease or even to put it into remission for a while. However, whenever you're going to push that immune system down, the patient is going to be at risk for infection or cancer, which is why the diagnosis has to be made correctly and it has to be made responsibly, because you don't want to put a patient at risk for the side effects of a medication that they may not have needed in the first place. And regardless of rheumatoid arthritis, in many parts of medicine, this is the hardest part or the most difficult for doctors to make the correct diagnosis. But as Uncle Ben said, with great power comes great responsibility. Until next time.